You have two arteries which come up and then join, and then bring blood flow to the back of your brain. Right here, this area is very narrow.
Oh my gosh.
I'm not really sure what's causing it to be narrowed. We can't really see that on the CAT scan. Usually that's the case. It is a plaque. But I spoke with our neurointerventionalist, who's the doctor who can go in and fix this and put a stent to open it up. And he says that this is not amenable to stenting right now. He would put you on 2 different medicines in order to prevent that from getting any worse. And just leave it the way it is. And if it does progress or get worse, then we talk about stenting it. Okay? So that's issue number 1. And that's what led to the symptoms you were having today, to the stroke that you had today. Okay?
It was a lack of blood to the brain.
Yeah, that's right.
A lot.
A small blockage. Now remember, your symptoms are almost completely gone right now. Right? All you have is that little bit of sensation that you're not controlling your leg real well, but you're walking great. Yeah, when I ask you to do complex movements with your leg, you're able to do it without any problem. And so that's all very reassuring. Yes. Right now we focus again our attention on finding out what caused this, so this is that, and then decreasing the risk that you're going to have another stroke again. Does that make sense? The other thing that you have is an aneurysm in your brain.
Oh, wow.
Okay?
The brain?
You have an aneurysm. Now, aneurysms are dangerous if they break and they bleed. Okay?
When you're a donor.
Well, depending on how much it is. The size of the aneurysm, right? How big the aneurysm is.
And how big is it?
So yours is 6 millimeters. And the size of the aneurysm determines how likely it is to bleed. Okay? Yours is big enough that we should fix it. Because it's probably going to break.
Wow. We got here just in time.
So it has nothing to do with your symptoms today. We just happened to see it when we were doing the CAT scan looking for this. Okay? So the same doctor who said, I can't do anything about this right now, right, and recommended the other stuff, said, hey, but this aneurysm we need to do something about because it's going to break. And so we're going to bring you to the hospital, okay? We'll get you seen by our neurologist and our neurointerventionalist, who's the doctor who does all those procedures, and we'll get you set up to get that fixed, the aneurysm.
Wow, that's much serious than I thought.
That's nasty business.
My heart's beating for you. I'm glad we did it. I'm glad we did what we did.
I'm glad you came in.
Yeah. This is something that needs to be taken care of right away.
Well, not right away.
Why?
Why? A day or two, I'll think about it. Can I go to this doctor's office?
So you're going to come into the hospital, and they're going to talk to you about tomorrow, and then you should get it taken care of soon. I would probably, you're going to be here. There's not an emergent need to do it today or tomorrow.
Right.
That being said, you're in the hospital. Everything's ready to do it. It would make sense to do it sooner rather than later.
Mm-hmm.
Well, no, but I have to take care of some things. I need to go home today. Definitely. I'm not going to spend the night here or anything like that. And
So I would definitely spend the night in the hospital.
no, I'm not going to.
Okay.
I want to see these doctors. You give me the name and make appointments, and I come in to see them maybe tomorrow.
You can see him in the morning?
No, because maybe I could come Tuesday morning, because tomorrow, first thing, I go to the lawyer, Monday, to do that doctor's, what I want to be, I have to do some paperwork.
She wants to do her,
Advance directive?
yeah.
All that stuff. That's very important.
But don't they do that here?
Yes.
They do that here for you.
What?
They do that here for you.
They do it for me?
Yes.
Our chaplain
They have a
department,
system.
Do what?
Our chaplains do that here.
Really?
Yeah,
They,
they take care of that.
because there's,
It's a legal form? Is that legal? Because my son will just kill me. If the aneurysm doesn't kill me, my son will kill me, because he's been asking me to do that for a long time now. And I have done it.
well, you have your will in
The
place.
will and all that, huh?
You have your will in place.
Yeah. But not that stuff.
But an aneurysm is a very serious situation.
Yeah.
So
More.
more urgent than the aneurysm is this, narrowing.
What's more urgent?
This, narrowing.
Narrowing.
Because if this gets worse, this is in an unstable period right now. And It needs to stabilize a little bit. And if this blocks, you will die. Or worse than die, all of the brain
Become
that
paralyzed.
controls your body will die, and you will still be awake.
Oh my goodness.
And you will never be able to talk. You'll be able to just lay in bed and not communicate with anybody. So this is something that is quite
you
serious.
have that medicine here in the hospital?
We do.
You said 2 pills I have to
Yes,
take?
yes. And so, but we
Yeah,
also
let's
need to
start
watch
that
you.
immediately, right?
Yes, you already got those.
Huh?
You've already taken them.
No.
Yes,
The
Why?
aspirin, was there something else?
Plavix.
Okay.
Oh, I have.
Okay.
So
I
you took
have.
one of them.
I have lots of
The
plastics.
aspirin, yes.
I'll
So
check
that
it.
being said, the
took
symptoms
the
became
aspirin.
on, you did, and then the Plavix I've given you, I asked them to give you, I guess I haven't given it to you yet. This though, I would not, this is what I'm more worried. The aneurysm is something we caught it before it breaks. That's really good. We can intervene upon it and prevent it from killing you. Really good. This, however, is what caused you to be here. You've had a recent stroke. Right after you have a stroke, there's an increased chance of bleeding. You really should come to the hospital, because it is possible that this is a dynamic process, meaning that it's not just staying there. It's a potential, it will get worse. And if you're not here to intervene upon that right away, you could die.
You're not gonna make it. We need to.
So,
Ava, you have nothing to lose by one night staying here.
No, not what for? I mean, they can't operate me tomorrow. It's Sunday. No.
It's
I
not
want
Sunday.
to
It's
come-
Monday now.
So if this suddenly
Not
got
yet.
a lot worse, there are things that we would do.
You can become paralyzed.
Maybe.
If
You're
this
gonna be-
suddenly became a lot worse, there's things that we could do in order to open it back up
But
and
you
salvage
said
things.
this thing you drew there, throw the aneurysm. Throw the aneurysm.
Well, so that's on a different part of the blood vessels in your brain. There's lots of blood vessels going up. This is just 2 of
The main.
right? But this is what caused your symptoms here, okay? Right now, because your symptoms have improved so dramatically, right? We don't need to put you through the risk of this procedure. But if you were suddenly to get much worse, and this were to close off,
Yes.
yes, we could open it back up.
But
right?
this all can
But
transpire.
You need to be here in order for us to be able to do it.
But it can transpire in a matter of 20, 30 minutes, or
Sure, absolutely.
and she wouldn't have time to make it here.
No, you would die.
Die or be paralyzed.
Well, worse than paralyzed, right? Paralyzed is from the head, neck down. This is everything. Can't move, can't even move your eyes to communicate. Just there, locked in, unable to talk, but awake. Quite horrible.
And then?
So what I'm saying is you really need to come to the hospital. And I have to tell you, I feel strongly enough about this that if you choose to leave, you have to leave against medical advice, which means that I'm telling you as a doctor you need to stay, and you're saying
I
you're
think
ignoring what I'm telling you, and you're going on your own accord.
Yeah. At my age, I know better. And I can leave and I can go home and have a bowl of soup, because this is a killer right here. Probably I go home and die from eating this junk. I'm starving, I need to eat.
So we have
Tomorrow, I come back tomorrow.
so we have a menu of food that I'm happy to give you something better to eat than the chips.
Like what?
After 7, you have sandwich.
With what type of bread?
whatever they
We're
want.
worried about something much more important, right? We can give you a sandwich, fruit, but that's about it for after. I mean, sometimes we don't even feed people after midnight. Sarah, we can't have you recording in here.
I
I'm
have to
sorry.
record this
Yeah,
because her
that's okay.
son's not here.
Listen, I'm going to go home and then I come back tomorrow, because I can't stay here all night without. I have my dogs. I have.
I'll have to go
everything.
home and get the. I'll take care of the dogs. I'll take care of the dog.
No,
Ava,
I
this
don't want to
yeah, this
stay
is so
here. I just
risky.
can't. I just can't stay.
This
here.
is the most risk you have ever faced in your life right now.
Yeah, that's all good, but I don't want to stay. I want to come back tomorrow.
Ava, what if you
And
can't
tell
move
the
half of your
doctors
body?
and arrange all that, because I don't want to be here 2 or 3 days, and then the doctor said, "Yeah, we'll do it tomorrow. We'll do it tomorrow."
You'd rather
we'll do it
risk being
tomorrow."
paralyzed.
Yeah, that's okay. I'll take the risk. I don't want to stay. I need to go home. I need to go home.
This is not good.
I need to go home.
Ava, can
Which
can,
one? No,
can
no, no. Don't. now, this is worse than the aneurysm, you said, or the aneurysm is worse than this one? Because I misunderstood you. You said to me when you came in, the doctor doesn't want to do nothing about this. He said, not right now, we are not doing anything, remember? You said that. He
What I
doesn't
said-
want to do the stent.
So
You
what I
said
said
that,
was,
right?
with your symptoms the way they are right
Yes,
now,
yes.
with you being able to move everything and not having real severe symptoms, the risk of intervening upon this is not worth any benefit that we
Right.
would get. And it's
Okay.
better to just do the
Take the
medicine,
medicine, yes.
right? However, if this gets worse, and it can get worse very rapidly,
Yes,
right, then the risk and the benefit changes, and it would be worth intervening upon. But we need to do it very, very rapidly. And if you don't open it back up very rapidly, that part of your brain is very, very sensitive. And like I said, you would die, or you would be completely
right.
paralyzed, your whole body, not just neck
Okay,
down,
but there is
everything.
no doctor here and they're not coming in till tomorrow morning. So there is no difference waiting here or waiting at home.
No,
It's the same
that's,
thing.
no, that's not true, because you'll be here, you're gonna be in an area where we're watching you constantly overnight in order to make sure that there's no change in your condition. And if you're at home, there's no one to do that. And there is there's a neurologist that we have here, a neurointerventionalist is here, right, and a hospitalist
I
doctor.
hate changes, I hate changes.
I know.
I hate changes.
I know.
So all the doctors who would be needed in order to open this up are here. And that's why we do it this way. That's why you come in the hospital. If you didn't need to come in the hospital, we wouldn't do it, right? We don't just bring people in the hospital for whatever reason,
Right,
right? And so this really does take precedent over everything else. This is a big deal.
Okay, now.
And I do want you
You
to hear
have all
me.
those papers, do you have any, you know, the doctors, you said there's 2 doctors that are specialists in this type of thing?
Mm-hmm.
Who are they? And where were they born? And where went to school? That's all very important to me. Because I had 2 operations in America about my foot, and I was limping and like an old lady, miserable. And I had to go to Brazil, and a very brilliant man in Brazil operated my foot, and I've been dancing, walking, taking my dogs to the park.
So
doing
if
everything,
they
and
tell
I
you-
lost 25 pounds, which I gained from being useless and in bed in terrible
Hey.
pain with my foot. So I'm saying, what doctors are very important to me.
So I can tell you, before anybody's gonna do any procedures on you, or do any interventions upon you, they will
Yeah.
come talk to you. And they will talk to you
That's so
about
nice, yeah.
they will talk to you about all these things,
Yes, sir.
right? And they will introduce themselves, and you can ask whatever questions you like with regards to their competency and their skill set and their background and training, right? So no one's going to suddenly come in and
No, I know,
do
I know,
this.
I know.
So unless it's a complete emergency and we need to, right? And so rest assured that you're not going to be forced into using any doctor that you don't feel is appropriate.
So I know, but do you have the doctors here and their curriculum, if they're competent or not? That's not important, because I know you wouldn't hire them if they wouldn't be competent, right?
So what do you want? You want to know
Their
where the,
curriculum, yeah, where they went to school,
we can print
their
that out.
age and all
Sure,
that.
it's available. I can give you their name.
We can print it out.
Oh, good.
We can print it out right now and give it to you. Is that what you want to look at?
Yeah, of course, yes, very important.
Okay, so that just takes a second.
Like Dr. There's a wonderful a guy in Dallas in Baylor that I just adore. He does colonoscopies. So what type of doctor is that?
That's not a brain doctor. He's not a neurologist.
No, I know, but I know that.
Colonoscopy
But, I mean, I'm
is-
saying he's the best in
But
the
that's-
United
but
States,
that's
I
a-
would say.
that's for
He's
your- but-
I know, Claude. What I'm saying is that there's some great doctors in America, wonderful doctors,
Okay.
and here in Dallas and everything.
Okay.
What I'm saying is, yeah, and he has wonderful curriculum, very nice. And he's half German, half Italian, good looking, handsome, gorgeous, and very competent.
So-
But do you understand a colonoscopist
So,
will
so
not
I'm
do
happy
that?
to I'm
Okay.
happy to give you their names and
Yes, yes,
where
please,
they went
would
to
you?
school and their training
Yeah.
and residency and all of that is, Baylor offers all that information on every physician who works
Oh,
with them.
good, yeah, that's
So
what I
that's
thought,
definitely
yeah.
available. I don't have any problem doing that. But again, no one's going to do anything to you until you have a chance to meet them and talk to them. And